Trachea. The trachea, called the windpipe, lies in the midline, in lower part of the neck and in superior mediastinum. Lower end of larynx is continuous with the upper end of the trachea. The trachea ends by dividing into the right principal bronchus and left principal bronchus. It divides at the level to the lower border of manubrium sterni or lower border of fourth thoracic vertebra. Measurements: length 10 to 11 centimeters. External diameter in male 2 centimeter. In females 1.5 centimeter. The internal diameter is about 12 millimeters. Situation: upper end of the trachea lies at the level of the lower border of cricoid cartilage and in front of sixth cervical vertebra. Trachea lies straight in the median plane but deviates slightly to the right near its lower end. It runs downwards and slightly backwards following the curvature of spine. At its lower end, the bifurcation lies at the lower border of the fourth thoracic vertebra. Relations of trachea. Thoracic part of trachea. Anteriorly, it is related to skin, superficial fascia, deep fascia, manubrium sterni, sternohyoid and sternothyroid muscles, remains of thymus, left brachiocephalic and inferior thyroid veins, arch of aorta, brachiocephalic artery, left common carotid artery, deep cardiac plexus, few lymph nodes. Posteriorly, it is related to esophagus, vertebral column. On either side, it is related to corresponding pleura and lung. On right side, right vagus nerve, azygous vein, right brachiocephalic vein and superior vena cava. On the left side, arch of aorta, left common carotid artery, left subclavian artery, left recurrent laryngeal nerve. Cervical part of trachea. Anteriorly, it is related to skin, superficial fascia, investing layer of deep cervical fascia, suprasternal space and its contents, sternohyoid and sternothyroid muscles, pretracheal fascia covering thyroid gland, inferior thyroid veins, isthmus of thyroid gland. Posteriorly, it is related to recurrent laryngeal nerve, longus coli, esophagus. On each side, it is related to corresponding lobe of the thyroid gland, common carotid artery within the carotid sheath. Blood supply. Arterial supply. Inferior thyroid arteries. Venous drainage into left brachiocephalic vein via inferior thyroid veins. Lymphatic drainage, pretracheal and paratracheal lymph nodes. Nerve supply, parasympathetic nerves through vagus and recurrent laryngeal nerve. Sympathetic nerves are vasomotor and are derived from upper 4 or 5 thoracic segments of the spinal cord. Sympathetic fibers cause bronchodilation and parasympathetic nerves cause bronchoconstriction.